Welcome to our Mary Greeley Primetime Alive program, Common Infections and Appropriate Antibiotic Use in Older Adults. I'm Vicki Newell, and I manage the Primetime Alive program here at Mary Greeley. As a reminder, to sign up for any programs or to join Primetime Alive, you can go to mgmc.org/PTA. Our presenter today is Kim Welch. Kim received her associate degree at DMACC and her doctor of pharmacy at Drake University. She is a pharmacy resident at Mary Greeley and is a fully licensed pharmacist. Pharmacy Residence is a new 12-month program at Mary Greeley that prepares pharmacists to be a clinical hospital pharmacist. Please welcome Kim.
Can you hear me okay? All right. Thank you, Vicki, for a great introduction. And like she said, I am a pharmacy resident. So I am halfway done, more than halfway done. And during this residency program, I have so many opportunity to be part of outside of hospital organization and guest speakers. And this is one of the opportunity where I get to see great people and talk about great topic. So like she mentioned earlier, the topic today is the common infections and appropriate use of appropriate antibiotic use in older adults. So I will jump straight to the agenda. So this presentation, I would save about 40 minutes, and there will be another 20 minutes at the end for question or any discussion that we want to bring up. But if you have any question or need clarification during my presentation, just raise your hand. So these are the agenda that we are going to discuss through today. First is to answer some common questions related to the antibiotic use. First of all, what is antibiotic? What do they treat? What don't they treat? And what are the common side effects and serious side effects that antibiotic could cause? And then we need to understand what antibiotic resistance is and why it is important to take antibiotics only when they're needed. And then next, I will switch gear to talk about the sign and symptom of the most 4 common infection that could occur in older adults. They are pneumonia, skin infection, intra-abdominal infection, and urinary tract infection. And finally, I would provide some tips, just like daily basics tips that you can do to protect yourself and protect other people as well. So let's circle back to the common question. The first one is, what is an antibiotic? So antibiotics are medicines that fight infection caused by bacteria. Now, you might ask yourself, what is bacteria? Bacteria are germs. They live everywhere in the environment. They also live in outside of your body and even inside of your body. Normal circumstance, bacteria are harmless. Sometimes they even helpful, like gut flora or skin flora. But in other cases, it could cause infection, and that is when antibiotics come into play. So the way antibiotics work is to fight the bacteria by killing the bacteria or make it really difficult for the bacteria to grow and multiply. Being said, antibiotics only treat infection caused by bacteria like strep throat and other infections that I will talk deeper later on during this presentation. Antibiotics do not work for viruses like those that cause common colds, runny nose, or most sore throat, except the strep throat that I mentioned earlier. It doesn't work on the flu and most cases of chest colds like bronchitis. The CDC or the Center of Disease Control Organization also mentioned that common illnesses such as common sinus infection or ear infection sometimes do not need antibiotics because those common illnesses could get resolved by themselves. So the bottom line is when you take an antibiotic that you truly not need, it doesn't help you, but it also causes more harm than good because it could cause some side effects. So the common side effects that antibiotic could cause is rash, nausea, diarrhea, even yeast infection. More serious side effects would be the Clostridial difficile or C. diff diarrhea, which could be fatal, and then severe allergic reaction. Let's say if you take an antibiotic and you got anaphylaxis, or if you have any swelling or shortness of breath, those are considered really severe reaction. And the most important thing is antibiotic-resistant infections, which we are going to talk next. So what is antibiotic resistant? This is a naturally occurring process that happens when bacteria no longer respond to the antibiotic that designed to kill or suppress their growth. Bacteria are really smart. They constantly finding new way to avoid the effects of antibiotics used to treat the infection that bacteria caused. So there are so many mechanisms of action that I couldn't talk about it all day, but the CDC have done a really great job introducing those mechanisms of action. And this is just one of the some example that so basically on the website, you can find it on your own. There's like a one pager of like how antibiotic bacteria can overcome the effects of antibiotic. So these are just some example. On the top here is the body of the bacteria. So when the bacteria figure out a way to overcome that effect, it produce a gene called resistant genes. So the first one is the resistant gene can be transferred from one bacteria to another by a mechanism called phages. So phages is that robotic-looking mechanism when it grabs the gene from this bug and transfer it to the other bug. The next one is when the resistant gene can be transferred between two connected bugs. So they touch each other, and then the gene can be transferred from one to the other. Really, really smart. And then the last one is so the bacteria body is either dying or still alive, would then release those resistant gene out to the area, and then other bug would go and grab it, and then now they have that resistant gene. So why it is important to take antibiotics only when they're needed. 30% of all antibiotics in the US hospitals are not needed or not optimal. Globally, about at least 700,000 people die each year due to drug-resistant diseases. And inappropriate use of antibiotic could make a common infection become untreatable, which is really dangerous. And also, the estimated number of the year of 2050 antibiotic-resistant infections could cause about 10 million deaths if there's no action is taken. So knowing the potential consequences, at Mary Greeley, we do our best to make sure that antibiotic use is appropriate. And what we have done in the past to now is we implemented a program called antimicrobial stewardship. So what is an antimicrobial stewardship or antibiotic stewardship? Basically, these are the efforts to measure and improve how antibiotic is prescribed by provider and used by patient to make sure that it treats the infection, but also protect the patient from antibiotic resistance. So at Mary Greeley, we focus on making sure that the patient get the right antibiotic, the right dose, and the right duration. Let's say a patient is on antibiotic. The next day, the healthcare team will come and look at their regimen and maybe make some changes or even stop the antibiotic once we know more about their condition. And the benefit of our stewardship efforts is to increase the infection cure rate, reduce the treatment failure, reduce adverse drug reaction, and then reduce the antibiotic resistance. So we have done a really great job of making sure that everything is good and in place. So we recently got designated for the Antimicrobial Stewardship Center of Excellence by the Infectious Disease Society of America. This is a really big deal because this organization is huge. They provide clinical guidelines in terms of prescribing guideline for, and it get used by a lot of hospital and facility nationally. And this is a picture. So our program is co-led by Dr. Dan Fulton. He is the infectious disease specialist, and pharmacy clinical manager Jill Boldy. On the right side of the photo is Dr. Lindsay Rerai. She is also the infectious disease specialist, and she is also the top advisor to our antimicrobial stewardship program. So what are the actions has been done and is being done at Mary Greeley in terms of antimicrobial stewardship? We have a great diverse team of pharmacists, nurses, clinicians, and many more. In addition, we have a core group of well-trained antimicrobial stewardship pharmacists where every day they go to the patient chart and review their regimen and make recommendation based on the latest evidence-based clinical guideline. And then we know that physician or clinician process a lot of information, complex information every day to the patient. So our job is there, be available to provide any education, any recommendation based on the latest evidence-based prescribing practices. And we also have processes and policy in place to consistently provide that high quality antimicrobial stewardship principles and also demonstrate that high level of commitment to what we consider is that our antimicrobial stewardship program. So let's switch gear to common infections. Sorry, I'm going to take it really quick. The first infection is pneumonia. Pneumonia is an infection of your lungs. Bacteria or viruses can cause pneumonia. In the United States, those viruses that usually cause pneumonia are influenza viruses, respiratory syncytial viruses or RSV, SARS-CoV-2, which is the virus that caused COVID-19. And then there's certain group of people who are at higher risk for pneumonia, who are older than 65, or children who are younger than 5, or if you have other medical condition like asthma, COPD, diabetes, or heart conditions, or smoking could increase risk of pneumonia. The typical sign and symptom of pneumonia includes cough, sputum production. You would have some difficult when you breathe, and then some mild fever. And then when you go to see your doctor, they would listen to your lung, and that is when they find out, oh, you have abnormal lung sounds, and then they find out that you have some low oxygen in your body because you can't breathe really well. So the core treatment for pneumonia is antibiotics. Whether you have a mild pneumonia, you can take oral antibiotic at outpatient. If you have severe pneumonia, we need to go to hospital, and then we give you the IV antibiotics. But the thing that could protect yourself is immunizations, not only for that pneumococcal for pneumonia, but also the viruses like flu vaccine, COVID, RSV. And other tests that you can do every day, like hand wash, and then if you outside and you can't have access to water, then bring a hand sanitizer with you all the time, and also avoid to be around people who are sick. It's really important to, especially in like gathering season, to ask your family if anyone's sick, or let them know if you're sick, just to prevent any unwanted sickness around. And also take good care of yourself as always. So when I talk about pneumonia, I automatically think about respiratory condition. And I found that some people might have hard time differentiating what is cold, what is the flu, and even seasonal allergy. So using this as an opportunity to talk a little bit about what is the sign and symptom of flu or cold or seasonal allergy, just for you, for your information. So the CDC had a really great table comparing the sign and symptom of the cold. So I'm just going to walk through it really quick here. For influenza, the symptom onset is usually abrupt. People will show fever, they have achiness throughout the body, they also have the chills because they have that fever. Fatigue and weakness is really profound in influenza. However, you don't have that sinus symptom like sneezing or runny nose or sore throat. But then you might have some cough, some chest discomfort, or headache also. On the flip side, when you have a cold, it comes gradually. A cold usually lasts from 7 to 14 days. And you don't usually have fever, and you might have some achiness, some fatigue. However, it's probably vary per individual, but it's not as profound as influenza. But you for sure have those stuffy nose, sore throat, sneezing, and you might have some cough and chest discomfort. I would say depends on how much you cough, either dry or productive cough. And then headache may or maybe. So what do you do with influenza? Like I mentioned earlier, yearly flu vaccine is always recommended around September, October time is a time when you need to take your flu shot. And then if you notice that you have those signs and symptoms of influenza, you may reach out to your provider because it is recommended if your symptom appear within 48 hours, you could take the antiviral medication just to help with that. But the bottom line is supportive care, where you have enough rest, you have enough sleep, and then you eat well, had hop soup, something that make you feel better. How about cold? We don't have any treatment for cold, unfortunately. However, depends on what symptom you have for cold, to treat that symptom only. Let's say if you have sore throat, treat for sore throat or cough or nasal congestion. Again, supportive care is what we really highly recommend, resting, sleeping. If you have dry cough or even productive cough or sore throat, maybe try the cool mist humidifier. But in the winter time, like right now, it might be too cold. So you can try the warm mist vaporizer. Or if you have nose congestion, you can use the saline nose spray. And then again, eat well, have some soup or chicken broth. One thing I want to emphasize is sometimes you found over-the-counter products like vitamin C, zinc, echinacea. Those will not prevent cold. There's not enough data out there for us to recommend any product at this point to prevent cold. These products, you can take them as a supplement, but if you take more than it's suggested, it won't help with preventing cold, but it's also cause side effects. So about seasonal allergy, sign and symptom typical for runny nose, red, watery eyes, sneezing and itching, and nasal congestion. We always want to recommend you to try the non-medication route first. Like the first one is really obvious, it's common sense, to avoid anything that causes that allergic reaction or allergen. Like let's say if you're allergic to pet hair or something like that, I would recommend wash your bedding or your curtain or anything that could caught that hair more often. So that could help a little bit. In the summertime or springtime when the pollen season comes, maybe avoid opening your window for so long so you can avoid that exposure. But you can't avoid the nice weather, right? I mean, in wintertime, it's not that bad, but summertime, you want to have a long walk and all that. So if you can avoid that, other option like saline nose sprays, sinus rin. I'm not sure if it's popular, if anyone use it, neti pot. One thing I want to recommend is to use that distilled or boiled water that cool down because they can reduce the risk of infection. Now, you try every single thing on this and you still have the sign and symptom of seasonal allergy. That is when you could consider medication. Again, only treat the symptom that you have. Everyone has different sign and symptom when they have seasonal allergy. And the next question is, do you need systemic or do you need just something that treat the local effects? Systemic is when you take oral medication where it works throughout your body, but it also causes side effects. Versus the topical products, we have here is the intranasal corticosteroid spray. So the first 4 products are just common over-the-counter product like Nasacort AQ, Flonase. We also have Flonase Sensimist, Rhinocort's allergy sprays. Those for just like the localized effects. If you have like nose congestion or sinus around here. And the last product here is Astapro. It's actually an antihistamine. So if you have any itchy sensation, that could help too. And then, like I mentioned earlier, if you have red eye or itchy eyes, eye drop could be an option. And then the bottom line here is antihistamine, which is the over-the-counter product that you can get everywhere. I only listed some newer generation that relatively safer than the old antihistamine where it caused like super drowsiness, sleepiness, side effects. So these are listed from most sedating to least sedating. Benadryl or diphenhydramine, compared to the old generation, is way far less sedating. However, compared to these medication, it has more sedative effect. And then down the list is Zyrtec. And then the last two are Allegra and Claritine. These two are second generation of antihistamine, and they consider to be equal. I've seen a lot of people try the Claritine. It doesn't have that drowsiness, doesn't have that sedating effect, and it also lasts long during the day. If you work outside in the yard or if you work during the day, Claritine should be the good one because it lasts longer. Okay, next type of infection is the skin infection. So skin infection occur when bacteria infect your skin or the deep tissue beneath the skin. Cellulitis is the common type of skin infection where it causes some redness, some swelling, and then the pain wherever the infected area of your skin. Another skin infection is called skin with abscess. The only difference is that it builds some pus underneath the skin. So these are the common factors that could put you at a higher risk getting skin infection. When you have some injured or wound on your skin, that is obvious because bacteria can go underneath and infect your skin. Or if you have any skin condition like athlete's foot, or if you have eczema, chronic swelling of the legs or arms, obesity, diabetes. So sign and symptom of skin infection can come gradually or suddenly. Like I mentioned earlier, it causes some redness, pain, tenderness, and whenever the skin is touched, it feels warm, and then it causes some swelling. With the abscess, sometimes that pus can pop and then drain out, or we need to drain it out when you go see your doctor. So treatment, straightforward antibiotic. If it's a mild skin infection, you can take it orally. If it's severe or you have that abscess that need to be drained, then you might need to go see your doctor or go to the hospital so we can drain the pus out for you. So the next one is intra-abdominal infection. This table seems really busy. So basically, intra-abdominal infection is like a big umbrella where underneath of it is the numbers of infectious processes that could happen throughout your abdominal or your belly. So the table here includes the list of common intra-abdominal infection where it point out the location or the type of organ that could be infected. The first one is a peritonitis. So basically, the lining of your belly get infected. People who has this type of infection said they have really severe belly pain that get worse in any motion. And when they touch, it's really sore, it's really swollen. People sometimes cannot make urine or make less urine and not able to go make bowel movement or pass gas. It is considered a severe medical condition when you have to seek out for medical attention right away because we need to treat them with antibiotics. And if we suspicious if it's suspicious to have any underlying issue, then we can go inside to see what's going on, and then we can get rid of whatever causing the issue for you. And after that, one thing what we need to recommend is rest well, and then have low salt diet, because we just want to minimize that fluid built up in your belly. Next is diverticulitis. I think this is really common, especially so when I work at an outpatient pharmacy, we see a lot of this of antibiotics that prescribed for diverticulitis. And you can take it orally, or if it's severe, then you have to go to the doctor for IV antibiotics. Basically, this is an infection of your digestive tract, most commonly your colon. And people would describe that they have the low left-sided belly pain and tenderness. Some people has constipation is more common than diarrhea. So what we would recommend is if you have a mild diverticulitis, the key thing is to rest, drink a lot of fluid, and then take your antibiotic. Again, if it's severe, we need to do some surgical procedure. But way to prevent diverticulitis is regular exercise, weight loss, and low fat diet and high fiber diet. The next one is cholecystitis. Basically, this is inflammation of your gallbladder. So when you have this type of infection, you would feel that intense sudden pain on your upper right of the belly. Sometimes you can have loose stool, and the color of your stool is kind of light, and you might have jaundice, which is the yellow looking on your skin. A lot of time when people go to the hospital, and we learn that they might have some gallstone, so that need to be removed, and then we give them antibiotic. But other time when you have that inflammation in your gallbladder and there's no stone, that could be due to high fat diet. So we would recommend to avoid high fat diet. And we also have some type of medication that you could take to prevent that from happening again. The next two, intra-abdominal infection, are pretty similar to that gallbladder one, because the way these organs sit in your body, they're really close to each other, so they kind of connected. So you can see the similar sign and symptom of where you got these intra-abdominal infection as well. Cholangitis is the bile duct system inflammation of the bile duct system. Again, pain on your upper right corner here. However, the stool color is a little different. It has the clay color stool, and you might have some dark urine. But the intervention is pretty similar. If you find stone, you remove that stone. If you find that the bile duct is obstructive, then we drain the duct so the bile juice can come out, or we might even need some stent to keep that bile duct open. And then we give you some biotics and then fluids. Last one is pancreatitis. So pancreatitis is the inflammation of your pancreas. This could be chronic. This could be acute. So you would have severe belly pain, and that may spread to your back and to your chest, and it works after you eat. And then when you touch, it's around the upper belly here. It's really tender and sore. The core treatment that we do here is we try to give you a lot of fluid and then pain control, because the pain is really severe. Majority of the time, we do not need antibiotic, but recommend you to have low-fat diet, again, because that could cause that obstruction in the pancreas or stone buildup. And if needed, and if we found any bacteria, then we would treat it with antibiotics. That's a lot of information for intra-abdominal infection. I know that it's crazy, but we've seen it a lot, and I think it's really helpful. Put it in a chart so you can refer back to it when you like, oh, what is that? And then you can come back to the table. So the last one is a very common infection in an older adult, is urinary tract infection, or UTI. So this happens when the bacteria, either from your skin or your rectum, infect the urinary tract. Now, the urinary tract had multiple parts, and it could infect in any spot of your urinary tract. But the most common one is your bladder infection, which we call cystitis. Other type of infection is called the kidney infection, which pyelonephritis is a really hard word. And it is less common, but when it happens, it's more serious than the bladder infection. There are several risk factors that you need to probably pay attention to, like if you have previous UTI, then you're more likely to have a recurrent UTI. And in female that at the menopause age, similar to pneumonia, if you're older or if you are a little kid, then you're more likely to be susceptible to UTI. And if you have any mechanical issue where you have enlarged prostate and then poor hygiene. Sign and symptom of UTI, pretty much where you have that frequent painful burning sensation when you try to urinate, and also this urging sensation to urinate when you don't actually have any urine. And if you have that kidney infection, you might have some low back pain. We call flank pain too, if you heard that before. And then nausea, vomiting, fever. Some people might not show these clinical signs and symptoms. Sometimes they show up with confusion, alter mental status, and then later on we find out they have a UTI. So treatment is pretty straightforward. You can take oral antibiotic, you can take IV antibiotic, but the key thing is to stay hydrated. Okay, so I've talked so much about antibiotic, what it needed for, what they don't treat, antibiotic resistant, what we do at Mayor Greeley to make sure that antibiotic is used appropriately, and I talked about common infections. What can you do to help yourself? These are just really common sense tips that you could do day-to-day basic, and these are actually from the CDC that I copy. So again, wash your hands, clean your hand with soap. It's specifically for about 20 seconds. If you don't have access to water, like if you're outside, like I mentioned earlier, have your hand sanitizer with you. And it's said to be at least 60% of alcohol, so that's good to know. And of course, when you cough or sneeze, cover it with tissue or with your elbow, just to prevent any spreading of germs. And then stay home when you're sick. Like I mentioned earlier with the cold and flu, supportive care is very important when you have enough rest, when you sleep, and that is where you stay home, just to keep yourself safe and other people safe. And avoid touching face. I think this is important in public places when you touch the doorknobs, touch things that people would touch. Just try to, I know that it's really hard to not touch your face sometimes, especially when you think, but just keep that in mind. And again, avoid contact with someone who is sick. This is, I've talked about this several times to get vaccination, especially when the flu season is coming or is already ongoing. Flu vaccine, your RSV, your COVID booster, your pneumococcal series, if you're not done already. And then if you truly need antibiotic, we highly recommend to take antibiotic as directed. It's typically a short course, so just take it, stick with it until you're done. Even you feel better, just take it, because what it works is to really completely suppress the bacterial growth. So it's there for you, just follow the direction. And then when you come across products, either on TV or in the pharmacy where you see the products that said, oh, this could cure or prevent cold, anything like that, just talk to your provider or your pharmacist first, because like I mentioned earlier, we don't have enough data. And if you think that would be helpful, just talk to us just so we can maybe check if there's any drug interaction, food interaction, or any potential side effect that we would want to let you know. So these are just the take-home message recap of whatever we've been talking about. By this time, hopefully you know that what antibiotic is, and they can save life. However, they only need in certain bacterial infection, and sometimes common infection would not need antibiotic because you can get better by itself. And then again, antibiotic do not treat virus, and then by this time, you should know that taking antibiotic could contribute to the development of antibiotic resistance. If you need antibiotic, take it as a directed. And again, talk to you. Oh, this one is really important. I make sure I explain it to you. So when you have an antibiotic and you take them, it is really important to let your doctor know whether you have intolerance or if you have hypersensitivity, which is like truly allergic reaction. Because when you have nausea or abdominal pain, that's called intolerance. But if you have like anaphylaxis or you have swelling or you can't breathe, those are truly, and it's really important for us to know what's going on, what was the reaction, because down the road, you may or may not need the similar antibiotics, and we could make a better clinical decision whether or not you can't tolerate it or if you have true allergic reaction. And then lastly, do your best to stay healthy and to keep others healthy. Thank you so much. I have at the end here is my email. If you have any question, when you get home, just feel free to email me. And now it's time for questions.
Yeah,
Thank you.
And I have the microphone, so raise your hand if you have a question. I will start us out, and you kind of alluded, I think, to some of this. The people who used to think have been told they have a penicillin allergy. My mom was one of those, and we were surprised, later in life when she had to have some treatment, and we said, oh no, she's allergic. And they said, well, we want to test. We find most aren't. And she wasn't.
Yes.
I was with her when she had her, 40 years before I had her. So, just I think a lot more common. I think people used to be told that so easily that, oh, you're allergic to penicillin, you can't take it. But it's so important now to really know if you are.
Yes. So I'm actually, this is kind of cool, get to share a little bit. So I'm doing a year-long project where I want to identify certain population, like people who has elective surgery or people who deliver baby, that has charted penicillin allergy. I just want to know if they truly have, and what we been doing, and what can be done differently when we have that process of figuring it out ahead of time if the patient truly has allergy or not. Because it is really important to have the right guided first-line antibiotic versus alternative, which more expensive, more toxic, and it could increase antibiotic resistance. Yeah.
All right. Well, good. I think that's a good reminder for all of us.
So what would be the signs, excuse me, if a cold or flu is changing into or bringing on pneumonia? Because it seems like we hear stories about people, they were sick, they had a cold, they just didn't seem to be getting better. All of a sudden, suddenly they're in the hospital with pneumonia, and that's very serious. So how would you know that when you're crossing that line, kind of?
Yeah, so I would say it is a really good question. So I would say when you have a cold or influenza, it's more like an upper of your lung. When you feel that like clot up of like sputum and all that going down, and you feel like, oh, it's getting worse, it's getting lower, and then you just cough a lot and you have that productive cough, I would seek out, especially when you have for more than, I would say 10 days or something, and it's just getting worse. I would seek out to your doctor if you're not able to breathe and then you have fever. The key thing is like getting enough oxygen and breathe. And then the second thing is fever. Those are important. And then you just cough constantly and not getting any better. There's not like a really like straight line. It's just something that you don't feel great, like no matter what you try. And then it's just not getting better. I hope it makes sense.
I think those are also great times to utilize. How many of you use My Chart? And how many of you use it to send questions to your doctor? I mean, I think those are great times to say, hey, I thought it was a cold, but I've had it now for 10 days. I feel like it's getting worse, things like that. I think it's great because it's not immediate. You know, it's got to be something where you're not having an emergent situation. But if you feel yourself, they get back to you. I think they say to give them at least 2 days, but they're usually much quicker than that. But yeah, it's very convenient to have that option. Other questions? Tim, do you have any online?
No online questions.
Well, Kim, you really must have answered everything. So how about this? Is there, you're in school, some of the latest and greatest. Is there anything new coming out, new antibiotics, things that we should be watching for?
At least this is what I was taught during school. Antibiotic is not something that can change like other drug class because it treat the bugs, it work, it do their job. Why would you invent something more expensive? So I don't think there's like, in terms of antibiotics, unless, I'm not sure if anyone
She has a couple
noticed
colleagues
anything.
here
Yeah,
with her today.
that I was told before, like, yeah, antibiotic, you don't invest in company that make antibiotic because you find out something that worked really well and it doesn't have a lot of side effects, and you stick with it because you know what it treated. So
Well, and it sounds like really they're trying to go back to the start, trying to get back to the penicillin, the more basic,
it actually,
if they can.
yeah, penicillin is it's in the drug class called beta-lactam, and it's a really broad, have so many type of beta-lactam, and it's really helpful in like strep throat. If you have strep throat, that's the goal for. Or if you have surgery, then we use first generation of cephalosporin, which is a beta-lactam, which is super helpful for surgical site infection prophylaxis, something like that. So they have indication. And we try to use guideline and evidence-based to make recommendation for antibiotic use. So,
All right. We do have a question. 1 second here.
My brother was 19 when he was diagnosed with, he had pneumonia of some sort, and he had penicillin. Mm-hmm. After that, he came down with rheumatoid arthritis. And they felt that he got it because of the penicillin. And so I was wondering if you had ever heard about that or heard of any diseases or anything else that's caused from penicillin.
I honestly I've never heard that before. It could be a possibility, but I've never heard that before. Yeah.
And that was how many years ago? Maybe we know a lot more today than we knew back then as well. Yeah.
Yeah.
All right. Any other last ones before we? All right. Well, Kim, thank you. That was a great program. Appreciate all the time you put into preparing and presenting for us. And thank you, all of you, for coming out today and braving the cold. Glad that you made it, and everybody who joined us online. Please fill out your evaluations. Give us ideas of other topics and other presenters you would like to hear from. A reminder, our next program is Tuesday, February 20th. So we have a little bit of a break here. Staying whole in a processed world. Let's chat about processed foods. And then Thursday, February 29th, both of these at 2 p.m. in this auditorium, atrial fibrillation, what you need to know. So once again, thank you, everyone. Thank you, Kim, and have a great day.
Well, thank you for having me today.